Thank you, Maureen. Assalamu alaikum. Hello, everyone. Good afternoon, good morning. Greetings from Cairo, Egypt. And thank you, MIIS and African Center for Science and International Security for this amazing opportunity. Super excited to be here with you, joining the eminent team of the speakers at this panel. Okay, so I'm going to get started, and it will be a brief reflection on my own personal experience during wave 2 of COVID-19. As you may all know, in Africa, Egypt was the first country that reported a first case of COVID-19 on February 14, 2020. During 2020 pandemic, Egypt, like most of the country, have seen a two-wave pattern in reported case of COVID-19. The first wave in Egypt was during the spring season, and there is a current second wave which started late in December. Actually, as of July, life in the country had returned to relative normality, except for mandatory wearing of face mask and maintaining a safe social distance. However, at the end of December, the number of cases of patients with COVID-19 began to increase, and it once again presented numbers similar to those in April. Funny enough, Egyptians thought that the second wave of COVID-19, it treated the same way as a second child is treated, with less care and less importance. So people started with the second wave with less strict measures of wearing the mask. They start to gather, they start to celebrate the end of lockdown. So we can see so many weddings, so many outings. So the second wave was not as important as the first wave, though the number of cases and then mortality rates was similar to the first one. So we had some sort of quiet time between the first and second wave, almost 6 months. And that presented a priceless opportunity for all systems to recover and to look back at their performance and response during the first wave of COVID-19, and to prepare for the next threat, whether it was the second wave for COVID-19 or any emerging threat. Understanding that the time required for systems to recover and apply vast sets of technical and operational intervention varies among the systems and mainly depends on the existing infrastructure and valuable resources. Few systems were actually capable to leverage this quiet time and was able to respond very well during the second phase. So I'm going to talk on 3 important systems from my own personal view: the education, the economy, and the healthcare system. I will start with the education, since I'm an educator at the Faculty of Medicine of Ain Shams University. And I have to say that we did really well during the second wave compared to the first one. During the first wave, we were very confused. We were not expecting this lockdown, and so the transition to the online teaching was very difficult time for us. For me, I had to deliver presentation or the lectures and recorded to be delivered to the students online. And it was a rough time for me because I haven't been trained on this kind of lectures. We always have this lively sessions with the students and interactive sessions. So turning into recorded sessions was a very difficult time for me. And since we were not trained, and we received always a long list of instructions, how to record, how to upload the lectures, it was very, very confusing for us. And I believe that I was not satisfied, and it was not satisfactory process for most of the educators. And I can see that even for my lectures and other colleagues' lectures, it was most like robot presenting or reading the slides. It wasn't the kind of lecture that we hope that our students would benefit from. However, during this wave, things ran very smoothly. We were trained during the summertime. We had time to prepare ourselves to record the lecture in different ways. Unfortunately, we don't have the capacity to have this live session, so we have to record the lecture and upload it, and the students can view it at their convenience. But it was much better than the first wave. And I think that goes for the higher education as well as elementary education. The online classes ran very smoothly, and I can tell that from my children at school. It was well prepared, and all the teachers and the students were prepared for such coming wave. If I'm going to talk about the economy, of course, economic activity slowed with social distancing measures and the temporary suspension of air traffic. Once the lockdown was eased and people came out, I would say, from their caves, just celebrating the end of lockdown, I think this revived the economy. And I have to say the ending lockdown saved the Egyptian economy from severe downturns. To help the economy during the current wave, the second wave, Egypt hosted a 2021 World Men's Handball Championship with the participation of 32 teams from 4 confederations. To be honest, when I heard this news, I thought this is not the time to host such a big event, especially that we were overloading the hospital and the laboratories with the infected patients. But at the end and with the conclusion of this championship, and everybody applauded the measures that were taken to help to ensure the safety of the players and also the organization. I felt that this was a drastic measure had to be taken, because the economy really needs this kind of events to be able to survive for the current wave. And I think it was a great decision to take, among other decisions that was taken to also to revive the tourism in Egypt. There was so many campaigns to help the tourists to come to Egypt and encourage them to enjoy the beaches in this time, exactly because we have the sunny beaches now, though it is winter season. So let's now move to the healthcare system. And I think I have a lot to say about the healthcare system, because unfortunately, for many countries, COVID-19 has been a moment of truth for all nations' health infrastructure. And for Egypt, it was obvious that based on the number of morbidities and mortalities, especially among the healthcare workers, that the infrastructure is inadequate, and we need to reform, or there must be a reform for the healthcare system to be able to fit for its purpose, which is delivering adequate and equally distributed service. The first wave was, of course, an opportunity for government to address the challenges that doctors and the healthcare providers always face, which is a lack of trainings and a lack of personal protective equipment, and also to enforce stringent measures for infection prevention and control. But as you all know, 6 months would not be enough to make all these changes. So unfortunately, in the second wave, we faced almost the same challenges we faced during phase 1 or wave 1 of COVID-19. One more important thing also, we suffer from a lack of capacity of laboratories, and which is still limited by shortage of personnel trained to run the test, and an adequate stock of materials needed to do these tests. So far, we don't have information, for example, relevant to the new strains of COVID-19, because not all laboratories are equipped with a sequencer that is needed to identify the mutant strain of COVID-19. And this information would be very important for us, because as you all know, the major concern now for the country is that this mutant strain would combat the efficacy of the vaccine. And so till now in Egypt, there is no data about this new strain, whether it exists or not in Egypt, and the limited capacity also of the laboratory in testing limit our information about the extent of the burden of the disease. and I've mentioned this during my webinar. I hope Margarita have shared the link, that though the limitation of testing still is a reflection of what is going on with the infection rate in Egypt. But we hope that the more screening and more testing would be possible to give us a better view of what is the extent of the disease and the geographical distribution of the infection of COVID-19. The good news about the healthcare system, that the government has recently announced increase in the budget for the healthcare system, and this is truly commendable. But since the health sector has long suffered from poor financing, and there is always pressing need to sustain such increase over the coming years. So we're expecting that this increase would not be one-time decision. We need this increase to be sustained, because it's not only about COVID-19. We're still expecting there is more emerging threats coming, and we need to have a better response to the emerging threats. I will also talk at the end about the most talked about topic now in the social media and among the public. It's about the vaccination. Earlier last month, Egypt approved.
Yes,
okay, can you hear me? Okay. So I was important topic, and the in Egyptian society now, it's about the vaccination. We have seen several versions of the vaccines. Each country has its own vaccines and vaccination policies. And in earlier last month, Egypt approved the emergency use of the Chinese Sinopharm vaccine with a priority vaccination program given to medical frontliners, patients suffering from chronic diseases, and the elderly. Egypt targets vaccinating around 207,000 in the medical staff in the isolation and chest and fever hospital nationwide. There's expected to be approved by end of this month, which is AstraZeneca. However, it's unclear if the country's immunization program would be free for all citizens, as officials signal that those able to pay for the vaccine can bear its cost separately without the state's support. We're not sure about this state, more like a rumor in social media that people may have to pay for the vaccine, but so far nobody confirmed this information. And I think the emergency use of the vaccine for the Chinese vaccine has already started with the healthcare providers. But again, the Chinese vaccine, we don't have the information about the efficacy of this vaccine is scarce, which discourage some of the healthcare providers to receive this vaccine. And there's now more campaigns to encourage people to receive the vaccine because of the fear of the side effects of the Chinese vaccine, which is less effective than the other vaccines that, for example, approved by FDA. So by time we would be able to access more data about these vaccines, so we can encourage the public to receive the vaccine. And this, of course, vaccine will play a critical role in the economic recovery, as it will allow people to resume to travel, help revive the tourism and the entertainment industries as well. This is more like a summary of my insights on the education, on the health and economy, and lastly on the vaccination. Thank you all, and over to you, Maureen.
Thank you very much, Maureen, and also to the Center as well as Afrixis, and for the kind invitation to participate in this very important course that you have had for a week or so, and seems to be still going on. Thank you also to the Norwegian Ministry of Foreign Affairs, who is the host. The ministry is also the kind donor of a project that I am currently involved with here in South Africa. We call the project the Atoms for Africa's Development, and we look at nuclear developments across the continent and how it can be used for for using nuclear energy's peaceful uses then to enhance development on the continent. We know that the COVID-19 has affected the continent in different ways from other countries in the global north, for example. In Africa, those that are vulnerable have become more vulnerable, and coupled with the continent's climate change issues, food insecurity issues, this pandemic has in a way made this more of a crisis at this time. So if you allow me, I would like to talk about the nuclear developments in the continent since the declaration of COVID-19 as a global pandemic. I had a look at the World Health Organization's statistics this morning of the status of the pandemic in the continent. All states are affected. There has been 2.5 million plus positive cases. There's been 2.2 million plus recoveries. There are sadly 65,000 deaths, almost that number of deaths recorded on the continent. But besides the work of the World Health Organization and others, Africa's response to the pandemic has been boosted by nuclear-derived technology and innovations, as well as their peaceful application in health and food, particularly the agricultural sector. And this underscores the value of the peaceful uses of nuclear energy to meeting the continent's response to the pandemic and its current and future development needs. Despite the pandemic, exploring nuclear energy as part of Africa's energy mix remains on the continent's agenda, as illustrated by a series of announcements since the outbreak of the pandemic in early 2020. The IAEA remains a vital partner in the continent's response to COVID-19. Lessons learned from the IAEA's assistance to West African states in the Ebola outbreak from 2014 to 2016 have been put to good use in assisting African countries to combat the pandemic. The IAEA is a member of the World Health Organization COVID-19 Crisis Management Team and has provided training to a number of African countries in nuclear-related techniques to detect and manage the spread of the virus. Besides the 270 active technical cooperation projects in Africa, the IAEA's technical cooperation projects in the continent, the IAEA has also provided direct assistance to 44 African states that include virtual training and orientation equipment and other diagnostic facilities. This includes nuclear-derived diagnostic detection equipment such as real-time polymerase chain reaction detection equipment, medical test kits, medical equipment cabinets to keep collected samples, equipment to improve national testing, laboratory consumables, and personal protective equipment. As the pandemic has highlighted the risk of zoonotic diseases, work in this area, in particular in Africa, has accelerated. The IAEA and the Food and Agriculture Organization has a joint project, the Veterinary Diagnostic Laboratory Network, VetLab, which is an association of veterinary laboratories in Africa and Asia. And they have been major contributors to Africa's COVID-19 response. VetLab includes laboratories in 32 African countries and work in 4 regional institutes in Botswana for Southern Africa, Cameroon for Central Africa, Cote d'Ivoire for West Africa, and Ethiopia for East Africa. These organizations have been assisting African countries to detect and control zoonotic diseases and improve health and security. And in June 2020, the IAEA launched a new initiative, Zodiac, that stands for Zoonotic Disease Integrated Action, to using nuclear-derived technology and techniques to prevent and detect the spread of zoonotic diseases. In other words, diseases between animals and humans. Zodiac will expand the work and upgrade the laboratories of VetLab to detect and manage future zoonotic diseases on the continent. Let me focus on 2 aspects that are crucial for Africa in this time: food security and energy security. Let me focus on food security first. Food security has been identified as a key concern during the pandemic to prevent hunger and further immune deficiencies in vulnerable populations. In Uganda, for example, where most of the population is employed in the agricultural sector, the IAEA has continued its work on the verification of the quality of relief food supplies and milk, for example. Although COVID-19 is dominating the global health agenda, it has not halted the urgent need to focus on other medical and health concerns. The IAEA has hosted various webinars on other health issues, for example, on oncology. It's established in 2012, the African Radiation Oncology Network to assist oncology institutions and professionals, and also to assist now during this period, African radiotherapy departments that are experiencing certain challenges. Some of the key challenges have been the decreased production and lack of availability of radioisotopes and radiopharmaceuticals due to global travel restrictions, the fact that fewer people are at the office, and the suspension of mine operations or any other operations related to the production of these radiopharmaceuticals. South Africa, which is the continent's largest and a major global producer of medical isotopes, has experienced both decreased production. I'm so sorry for the interruption. It may be my connection. So basically, I talked about the food security where there has been efforts to improve the position in Africa, where the IAEA, for example, has continued to work with Uganda, for example, to test the quality of relief food supplies and milk. I also refer to the health issues that the IAEA have assisted with, including radiotherapy. And then another health issue, if I can just come back to that, has been the availability of radioisotopes and radiopharmaceuticals, which has been restricted due to production, but also due to the travel restrictions. And as you know, these isotopes have to transport as soon as possible because of their limited half-lives. Let me move on to energy security. I'll come back to food security. The pandemic has also underscored the importance of energy security as a key factor in mitigating the health crisis. Africa Energy Minister participated in a seminar on the continent's energy sector, where they reiterated the importance of reliable energy, not only for the future, but also the efforts to combat and respond to COVID-19. We know that a number of African countries like Ghana, South Africa, as well as Egypt, for example, are currently in the process of continuing its conversation and its efforts to improve and elaborate on its nuclear energy expansion plans. And we can discuss what those plans entail. But if we look at what has been happening in terms of governance and managing the COVID pandemic, the pandemic has undoubtedly compromised Africa's future developmental agenda. We know that Africa is in dire need of meeting not only the United Nations' Sustainable Development Goals, but also its own Blueprint for Development Agenda 2063. But there is also a need to focus on a social agenda. What we've seen in some parts of Africa is the outbreak of xenophobia associated with fear then of foreigners as part of certain myths that has been associated with the pandemic, so as that foreigners have brought in xenophobia. Further vulnerabilities have been increased, and certain myths have now arisen in the use of vaccines, or then the prevention of use of vaccines, which is another problem in the rollout programs of African governments in terms of the vaccines. Under the leadership of South Africa, of the African Union last year, the African Union has instituted the COVAX facility, which is a funding mechanism, but also a mechanism to obtain the vaccine to distribute across the continent. And some of that has already arrived on the continent. For example, on Monday, South Africa's first consignment of vaccines have arrived, only 1 million at this stage, and there will be a staggered rollout for health professionals that are currently on the front line of the combating of this disease. Well, we've also seen in Africa a large focus on South-South cooperation. For example, South Africa's serum have been, South Africa's vaccines, AstraZeneca, have been produced by the Serum Institute in India. We've also seen the Cuban health brigades working across the continent to combat and assist in the pandemic, to prevent and assist governments in that. But we've seen that on the continent, various challenges remain in terms of the peaceful use of nuclear energy. This year it is 61 years after the first nuclear weapon tests were conducted in Africa. The continent is exploring the advantages that the peaceful uses of nuclear energy can bring in its response to the pandemic. And I would be happy to elaborate on some of those besides the ones that I've mentioned. Alongside these existing initiatives, African governments and regional nuclear governments institutions should not only continue to do the good work that is already done, but also to continue with the good work that it has done with the IAEA, for example, and the United Nations. So what can Africa do that is more in helping it to mitigate the pandemic? African states should establish mechanisms to sustain the positive impact of nuclear-related technology obtained prior to and during the pandemic to gain post-pandemic developmental benefits. One of the best ways to do so is to strengthen the cooperation between the IAEA, as well as the effectiveness of the Africa Commission on Nuclear Energy, which is the watchdog or the implementing agency of the Pelindaba Treaty that makes Africa a nuclear weapons-free zone. But the Commission has also taken on a large developmental role, also because it is prescribed in terms of the Pelindaba Treaty. Cooperation between the IAEA and AFCO and between African countries have been formalized in memoranda of understanding, and the efforts are undergoing to fully strengthen AFCO's human resources to assist in Africa's developmental agenda. AFCON's full and sustainable operation is also crucial for the longevity and success of the Pelindaba Treaty. African states should commit to the full incorporation of AFCON into the AU reform process, and also AFCON should formalize its working relationship with the African Continental Free Trade Area, which is in the post-COVID-19 Africa, where free trade will have to help the economies of various countries and border regions to be able to bounce back, to improve at least the economic security of some of people that has been negatively affected. I would also make a case that the African Union's Pan-African University should be enhanced in this to improve training, education and research in the peaceful use of nuclear energy on the continent. And I wish that the Pan-African University can become involved in this kind of course that you are offering in order to strengthen the continents and its involvement in not only training women in STEM, but also in using the peaceful energy of nuclear energy to mitigate the effects of the pandemic. Just finally, coordination between AFCON and the African Developmental Agency, NEPAD, could also be improved to not only improve regional oversight, but also to educate African governments and their citizens about the need for nuclear governance compliance and the benefits of the peaceful uses of nuclear energy. And also then for our discussion today to help with the combating of the pandemic and also in future should zoonotic diseases disrupt again. Thank you very much for your attention.
Thank you very much, Jo-Ansie. That was very interesting in terms of the peaceful use of nuclear energy and some of the positive impacts we're seeing coming out of that. Collaborations, for example, between the IAEA, health and agriculture in controlling the pandemic. And as you say, there's some work to be done post-pandemic, but we hope that these benefits will continue on. So let us move forward then, Mona. If you are still with us, We have a question in the chat for you, and I also have a few questions I can raise as well. Okay, so one of the questions then, Mona, is with regards to the new strain, is there a different reagent used to conduct the tests for the variant strain? Is it PCR or rapid or both? I'm wondering if you, I'm not sure if this is within your expertise, but if you can take a moment to answer this question.
Yeah, sure. Can you hear me clearly?
Yes, we can.
So the current variants of the COVID-19 virus was actually detected by the current testing method, which is PCR, because actually PCR tests have multiple targets to detect the virus. And so far, there is no evidence that the latest strain impacting the testing activity, but it might in the future. But so far, these variants was able to be detected by the current testing method. The thing is that how we identified the variant, it's through, of course, more sophisticated testing. So at the beginning, we start with a PCR, which is positive. Some countries take it further to kind of look at the genetic code of each virus and see if there is any change than the norms. And that was detected in several countries. So only the countries that have the tools and the ability to do this sophisticated testing was able to identify this kind of variants. The rapid test, there are two types of rapid tests. One is for the antibodies, so it's not affected by the variants because the antibodies is the response of the immune system to the virus, and mostly it will be detected by the current test. The rapid antigen test, there's no data so far about the effective rapid antigen test to detect the current variant, but I believe the most important test for us, which has the best sensitivity and best specificity, would be the PCR. So till this moment, it can identify the current variant of the strain. And these variants, if I want to give it more easy explanation, it's more like typos in the genetic sequence of the virus. It's something like one letter has changed. So it's not affecting the whole virus, it's just one letter. So still the PCR can identify the virus, if that answers your question.
So we have a question from the attendees. I understand that COVID is a natural occurrence. Can it be detected in the atmosphere? And if yes, how?
I'm not sure what do you mean by atmosphere, but of course there is so many studies on detecting aerosolized samples from, for example, subways or in the environment where for an isolation ICUs where patients are located, and they can take air samples, and they found the virus, and that's why how they detect if the virus is airborne. That means it can be transmitted through air, and how long that would stay infective. So that, for example, some of the pathogens, you can just cough or sneeze or talk and leave the room, and still the pathogen is suspended in the air. So when you go inside the room, you can get infected. This is the main issue that they start to study with the infectivity of the virus. Does it remain in the air suspended for a long time that will keep us infected even though the people who are actually carrying the virus left the room, or it's about distancing, and only 1 meter distance will be able to protect you from acquiring the virus. So this is the most important debate on the virus. But of course, sampling of air is one of the environmental methods used to detect the virus, not only SARS-CoV-2 or COVID-19, but also any respiratory viruses. I hope if this is not clear enough, please send me back your questions. I'm not sure what the atmosphere mean, but for me it was air, because people start to talk and sneeze and spread the virus in air surrounding them.
We have about 10 minutes left in the session. Apologies for the interruptions with respect to the presentation from Kadi. So the question, we have one more question for you, Mona. If you're still with us,
Yes,
do you
I'm
think,
here.
good. Do you think radiation plays a role in controlling the infectiousness of the COVID-19 virus?
So if you mean by radiation, we have solar radiation, could be ultraviolet radiation. In terms of solar radiation, people were thinking that once the summer season comes, this will end the life of the virus. But unfortunately, it did not. And we are, as in Egypt, I'm sure most of African countries, they are hot and still suffering from cases of COVID-19. So radiation did not inactivate the virus, unfortunately. With regard to UV light, it's a kind of method we used actually to inactivate pathogens in general in our laboratories. And the virus seemed to be susceptible to UV light in terms that it becomes inactivated for a certain period of time using UV light. But more studies need to be done to identify the role of these types of radiation on COVID-19. We're still in the beginning of our research to identify what the factor that affects its effectivity and infectiousness. But for radiation, this is the information I have for this question right now. Thank you.
Thank you so much, Professor Mona. We have a question about vaccination, and Jo-Ansie, I'm wondering if you might like to attempt to answer this question. It's with reference to the existing vaccine production, given that it was for managing the initial COVID-19 strain. Do you know what plans may be underway to release perhaps the second batch of the vaccine that may have improved efficacy against the variants?
Yes, thank you very much. It is a good question, and of course in the minds of everybody, also here in South Africa, where we have seen new strains of the virus developing. South Africa has been involved in some of the trials of the new strain for some pharmaceutical companies, and some of these have been, data has been collected, and of course they are with the pharmaceutical companies. But of course, it remains to be seen how effective the first round has been. And for us in South Africa, with not only the new strain, but also with HIV/AIDS, as well as tuberculosis cases that are extremely high, we have a population that is very vulnerable, and we can only hope that there will be no side effects to existing medication for HIV/AIDS, etc. So what I also know is that the big companies that are involved in it currently, AstraZeneca, Pfizer and Johnson & Johnson, seems to be on a scale of 60 to 90% in terms of efficacy for the existing vaccines. But as we know, this has been produced prior to the outbreak of this new strain. And from what I've read, that it seems to be that these companies are in a next phase to react to these new strains. And we must be mindful that there are different strains across the world. There is a South African strain, and there have been different strains picked up elsewhere. But it seems like the South African strain has attracted attention, so hence the involvement of South African populations in the research. I hope that answers your question.